All right. Welcome, everybody, to our May Patient and Family Partnership Hub meeting, our community conversation. Welcome. Some Zoom features. We have our chat open and available. If you would like to add any questions or comments in the chat at any time, you are more than welcome to. You can also direct message anybody if you have any specific questions for somebody. We also have live transcript available. There's a CC on your menu. You can click that to get that live transcript if you need it. And then if you'd like to come off mute to join the conversation, you can just click raise hand and feel free to come off mute. And we've had a couple more people join us, so I'm going to re-enter the interpretation instructions in the chat there. If you need that interpretation, it is available for you, and it's there in the instructions are there in both English and Spanish in the chat. All right. Like I said, we are recording for note-taking purposes and do have that live transcript available. And this is our agenda for today. We'll do some introductions, and then we'll talk about the PFA Network Open House and the PFCC conference that we had a couple weeks ago. We did have some folks from LA County come to both the open house and the conference, so we'll debrief those events. And then we will talk about Patient Family Advisory Council within LA County and their recruitment. And I'll pass it off to Mike.
Good afternoon, everyone. Welcome to our Patient Family Partnership Hub community conversation. Thank you again so much for taking time from your day and joining us. Please know that we appreciate and value your time tremendously, and that we are helping, or that you are helping, shape the healthcare services for all our LA County community. Welcome again, everyone. Bienvenidos a todos. In a minute, we'll do some introductions. In addition to our PFCC partners, joining us today is Martin Conta from Green Translations, who will be helping us today by simultaneous translating our conversation in Spanish, and vice versa, we'll be helping our Spanish-speaking patient family advisors join in the conversation. Today, we aim to have a conversation like Laura just shared. I'm going to do a little debrief on the open house, as well as the PFCC conference, which took place earlier this month, as well as have a conversation around recruitment, as that is one of the heaviest lifts for this work. So we really kind of want to gain some insights on what we can do better and what strategies we could set up with that. My name is Miguel Renteria, and I go by Mike, and I'm an improvement advisor for DHS. My work evolves on patient experience and supporting our culture of patient-family engagement across our health system. What you see here is a slide that displays our mission. Our mission is to advance the health of our patients and our communities by providing extraordinary care. Our goals range from transforming our system to provide cost-effective care of the whole patient across the continuum, optimize clinical quality and patient experience, to have a high-performing workforce, and ensure financial viability and support of our vision. Today, we're moving towards our mission by advancing on our strategic goal of providing high-quality care and patient experience through engaging your voice to help us in our work. Your voice, your views, and your insights are incredibly important to our work. So thank you again for taking time off your day and joining us here this afternoon. Next slide. I'll pass it back over to you, Laura.
Thank you. Thanks, Mike. So my name is Laura Jackson. I'm the Director of Community with PFCC Partners, and we are partnering with LA County Department of Health Services to bring you this Patient Family Partnership Hub. So our mission at PFCC Partners is to center the inclusive human experience of health, reinvent through radical collaboration, and be a catalyst for system transformation. We do this through our values of equity, inclusion, diversity, collaboration, and being solution-focused. And our vision at PFCC Partners is a health system transformed. We want one that works with people and through communities as a partner in their well-being. And then this is kind of the patient family partnership hub structure. So within the Department of Health Services, there are 11 patient family advisory councils, which we actually will be talking a little bit about in our meeting today about those advisory councils. Some of you may be a part of one. And the Patient Family Partnership Hub encompasses everybody who is in those councils and anybody who may not be in those councils but do get service within LA County Department of Health Services. So we're just kind of all encompassing of DHS in general, and we're not specific to one facility. All right, let's do some introductions. So let us know your name, where you're calling in from, and what was your first job. So like I said, my name is Laura Jackson. I'm Director of Community at PFCC Partners. I live up in Eugene, Oregon, but our offices are down in Long Beach, California. And my first job was a dishwasher in a little bistro in my hometown. So I will go ahead and let's see here. Emily.
Hello, my name is Emily Tell. I'm a certified agent with LA Care, and the first job I had was at a deli in the town where I grew up in New Jersey.
Oh, nice, nice. Thank you for joining us, Emily.
Thank you for having me.
Maria.
Hola, buenas tardes. Mi nombre es María Vázquez.
Hello, good afternoon. My name is Maria Vasquez. My first work, my grandpa helped me to find it, and it was receiving the tortillas from the machine, from the tortilla machine. I burnt both hands because they were very hot, and that was my first job. I was a very little girl, a young girl. I was still a girl for my first job.
Thank you for sharing that, Maria. Thank you for joining us today. Joy.
Hello, my name is Joy. I'm from Long Beach, and my first job was cashier and server.
Nice, nice. Thank you for joining us, Joy. Olivia? Oh, I see that you put it in the chat. Martin, do you mind translating?
Absolutely.
Thank you.
Hello, my name is Olivia Tovar. And what? Okay, that's probably a typo there. I'm going to try to interpret that typo. Okay. Hello, my name is Olivia Tovar. I am with the organization Restaurant Opportunity Center, and my first job was sorting through clothes in a clothes factory. Thank you.
Thank you, Olivia. Thank you for joining us today. Pardon me if I mistake your name, Berenia.
Looks like their audio is still connecting. Maybe
Okay.
not on all the way.
Thank you. Thank you. We can come back to you, or you can add in the chat if you can hear us. Michelle.
Hi, my name is Michelle Rosser. I'm calling, well, I'm not calling, I'm from Los Angeles, and my first job was something doing in the community. cleaning up it was for teenagers.
Nice. Nice. Thank you. Thank you for joining us, Michelle.
Thank you.
Let's see here. Laura, Diego? Laura, you're on mute if you're talking.
No sé si estarás hablando, Laura, pero estás en mudo.
Hello?
Not sure she can hear us. This is your interpreter speaking.
Thank you. Thank you. All right, so Laura, if you can hear us, you are more than welcome also to add it into the chat. Your introduction there, Laura Diego, thank you. You're more than welcome to. Okay. And Ray, I know you just joined us. We're doing introductions. Let us know where you're calling in from and what was your first job?
Yes, thanks for having me. My first job ever was working at Parks and Rec and had a great time learning patients with kids, and it was full of physical activity, and yeah, really enjoyed it, and I miss it.
That sounds like a great job. Thank you. Thanks for joining us. Lindsay.
Hi, everyone. I'm Lindsay Galley. I'm the Vice President of Programs at PFCC Partners. I live in Sacramento, California. And my first job, I worked at Kohl's, the department store. I did the cash register, and I folded all the clothes, cleaned up the fitting rooms. And so now I have a great respect for cleaning up the fitting room when I'm done with it.
Same here. I've worked retail and I get caught straightening up the stores when I'm in there.
Exactly, me too.
Thank you. And it looks like, okay, Laura's audio is not working, but her first job was also retail. All right, let me just go through my list, make sure oh, Mike, you can go ahead and introduce yourself again.
Hi, good afternoon, everyone. My name is Mike Renteria. I'm an improvement advisor for DHS. My first job, or I'm calling from the San Fernando Valley here within LA County. My first job was at Levitt's Furniture while I was still in high school, my senior year in high school, assembling furniture. Yeah.
Thank you. All right, I want to make sure I got everybody. Okay, I think I did. Thank you, everyone, for joining us today and humoring me in my intro questions. I did want to talk about the patient community open house. It was May 1st, so quite a little bit ago, but our last meeting was all about the patient community open house and what it was going to be about, and inviting everyone to join us. So like I said, we did have the event and it was pretty wonderful. We had, I believe, around 20 patient family partners from across the US joining us. And as you can see in that picture down below, we had a few LA County patient family partners joining us that joined us as well. And it was a wonderful time of just getting to know each other, getting to know about the PFA network, and learning on how we can better improve the healthcare around us. So with that being said, we do want to talk a little bit about how we promoted the event and maybe get some ideas from you all on how we can best promote in-person events to patient and family partners within LA County. It seems like that is kind of, knock on wood, hopefully, where the future is going, with more in-person events and more get-togethers, and we can see each other face to face and not just our voices or faces on the screen. So for this event, we did promote by having postcards in both English and Spanish at facilities all across the DHS. We invited you all, and thank you to those who came. We talked about it in our, like I said, our last meeting, and then we did have it in meetings before. We did also promote to Patient Family Advisory Council facilitators so that they could pass it along to their councils and invite the patient family partners who are in those councils. And then to our partners, like I said, we at PFCC Partners are partnering with LA County Department of Health Services to bring you this hub to help with those PFACs. So we did send it out to our partners around LA County. But what we would like to know from you all is there anything else or what more we can do, or anything we can change also in the future to promote these in-person events? So I will open the floor up to you all. Feel free to come off mute and let us know if you have any ideas.
Hi, my name is Michelle.
Hi.
I don't know if I received the email, but I did not receive a card. And I'll just sharing that information.
Thank you. Thank you. Yeah, we put the cards in the facilities for them to give out to patients. So yes. Thank you though. Maybe sending out, like mailing those cards would be a good idea for the future.
Okay.
Everyone likes snail mail nowadays. I do, at least.
No, I like grabbing the cards or the newspapers.
Yeah.
That is, it makes the visiting the doctor's office more interesting.
Yeah. Totally understand that. Yeah, having something, I think, physical, like you said, to hold on to. I like that. Thank you, Michelle. Any other ideas?
Maybe the card can to utilize. I'm just over talking. I feel like
no.
Maybe the card can have a mini questionnaire on the back. I don't know what the questions would be. Maybe this platform can create the questions.
Yeah, that's a good idea. Kind of give more specific ideas of the discussions or things that will be talked about. I like that. Ray, you've got your hand up.
Yes, thank you. Yeah, just one thing to improve on maybe for those open houses, maybe making sure that some of the rooms, smaller rooms, have easier wheelchair access in the rear of the room, so we can have a better way to exit and enter the room. I know one of the rooms were filled up. We had to change rooms because I know the tables were kind of filled up all the way to the rear. And for us to navigate through there, we needed maybe not to have an extra table back there, or 2 extra tables to fit in the back. So that's the only thing that I really noticed about access as far as accessibility wise for wheelchairs.
Thank you so much, Ray. Yeah, that is something we've been talking about since the conference, of even though a facility says that it is accessible, we do want to take those extra steps to make sure that we can have everybody join us no matter what. So thank you so much for bringing that up, Ray. Joy, I saw you come off mute. Did you have a comment?
Oh, regarding how to do better promotion, I was going to say, when you're in the waiting room of the clinic with the monitors, maybe put some of that information up. Because
Oh, that's a
sometimes the cards are not there. Sometimes there's no brochures or bulletins, but the monitors are up and it's already displaying different types of information about, how to improve your health or what have you. And sometimes it's just television playing, just regular television programming. But I think that would probably be another way to do it.
That's a great idea. I didn't think about the monitors in the waiting rooms. Thank you so much. That way it's kind of much bigger than a postcard. Thank you, Joy. Any other ideas?
Laura, I might also ask, because this is something we talked about, any barriers to attending an open house or an in-person meeting. This was kind of our first toe in the water since the pandemic, and we learned a lot about being back in person again. But I'm just curious, as we go throughout the year and wanting to do maybe some potentially more in-person events, if there are any other barriers for individuals for attending events like this in person.
This is Michelle again. So when I was saying I did not get the postcard, it seems to me I did not go to the doctor enough in order to get the postcard. So I was saying word of mouth, maybe I'm going to a different doctor, like, I don't know, just word of mouth.
That's a good idea.
Yeah, it's a great point. Yeah, we don't want you to have to go to the doctor
Right.
to get the information. Thank you, Michelle. Great idea.
Also word of mouth could be mental health, because even though I'm not going to the primary care doctor or LA County, I'm a patient for other types of medical reasons. And so for example, mental health, and then there are groups, lots of clients that we come together once a month, once a week, and there's a lot of there's a lot of stuff going on. And if that information helps.
Yeah, and that is something we did actually talk about in the open house, is engaging those groups a little bit more. So those support groups, or like you said, the mental health community of those people that are, I'm trying to think of some of those off the top of my head and I can't think of them right now, but that is definitely something that I think we will be working on in the future. And thank you so much, Michelle, for bringing that up. It's a really great point. Any other thoughts on the possible barriers of joining in-person events as we move into those a little bit more? We want to be aware of those barriers so we can hopefully break through them next time. Yes, go ahead, Joy.
Or I actually have a question. In-person meetings, will they be at the same location or will it be rotating?
That's a great question. And I'm not talking about any specific, we don't have anything specifically at the moment. It's just kind of an in general, as meetings move into in-person or events move into in-person. We just are curious of the barriers that come up for folks to join those. That is a really great point of having, if you have a recurring in-person meeting, maybe to have it at one location rather than rotating. That way people can remember and it's easier to get to. That is a great question and something that we will definitely keep in mind in the future.
Yeah, and I think on the other hand, Laura, so this was at the California Endowment Center in downtown LA. So not the easiest to get to for
No.
everyone in LA County.
Yeah.
And LA County is so big. So I think it is a good question, Joy. We might consider potentially doing other community events like this, but in the specific LA County communities, especially those that are related to some of the health centers and the hospitals that we'll actually be talking about a little bit later in today's session. So yeah, so that's a really good question.
Mm-hmm. All right. Any other thoughts or ideas on the open house before we move on to the next thing? All right. So the day after the open house, we had our PFCC conference. And we again had many wonderful LA County patient and family partners and health, not health, and staff members there as well. As you could see, we had Mike there, of course. He was on our planning team and was on this panel talking about humanity in healthcare. And we did also have, which was really great, we did have an interpreter present doing that live translation for those who needed it. So we did have quite a few folks who did utilize that English to Spanish interpreter, and that was really wonderful to see and to have that resource there for folks. So looks like we do have a few people on our meeting now that we're there. And if I may pick on you, Ray, since I know you were at the conference, do you mind telling us a little bit about your experience at the conference and something that you learned throughout the day?
I'm sorry. Just something about the experience, right? About the conference.
Yeah.
Yeah. So I think it was a breath of fresh air, literally to be able to come together and after the pandemic stuff and see the way people are healing from it and starting to really have that person-to-person engagement, and the cool part is we could read people's body language, see their smiles, and it really felt, it was like not only a conference but a therapeutic healing conference, I like to call it, because of those reasons. And it was really nice. It was cool that also that we got a little pin at the and to be able to be part of, and the networking piece was also great because you got to meet different PACs and people new to everything that some people are starting it or wanting to start after the conference, their own PAC in their own clinics or hospital settings, different counties, and other states. So yeah, was able to pick up a few pointers, and I think it's invaluable to have so many perspectives on how the way people do things, because I look at them as nuggets of information where you could grab a little something from each one and possibly implement it to your council to improve on or enhance um, um, in different areas. So I think all in all, that's kind of what I got out of it, and yeah, just looking forward to more of them, and keep progressing and fine tuning, if you will, what we already have, or jump starting a new one.
Thank you so much, Ray. And for those of you who may not know or who weren't there, the PFCC conference is our annual conference that we do hold in LA, and it's very it's a unique one because we like to highlight the partnerships between patients and their healthcare organizations. So each presentation was about a partnership of how those healthcare organizations engage the patients and families in their community, in their who receive services from them, to improve the healthcare organization. So it was, like Ray said, a wonderful day of connecting with one another, seeing each other face to face. And I liked that therapeutic aspect of it, to be in person again as well, especially working from home, working remotely. It is great to be in a room full of people again, and learning new things from so many different people. And yeah, it was really great. Ray, was there anything that you learned that sticks out to you that you learned at the conference?
Yeah, I learned how great, like structurally, some people are really thorough and structurizing, and also how to build a team around the patient advisory council,
Mm.
and allocate certain responsibilities. So one, it's not too much weight on one or two people's shoulders, you
Mhm.
know, and have a nice little handful of people that could help run, help recruit, help take notes in meetings. Like it was really good, and we're actually taking some of these ideas and strategies they use and directly implementing on ours, because ours is I don't think it's balanced as far as what the responsibilities and duties are. So the more we delegate and put people in certain positions, I think the smoother it'll be, and the less weight it'll be on just one person doing multiple duties.
Mhm. Absolutely. Thank you so much, Ray. Yeah, I like that team aspect of it, and thinking of the patient advisory councils as a team, and you and the staff members, you work together to improve the organization and improve what is going on, and having that patient family partner perspective is so important, and really great. So thank you for letting me ask you some questions about the conference, Ray, and joining us on that day. It was great to meet you in person as well. I hadn't met you in person, so it was great to see you in person and see everybody there. All right, do we have any questions or comments about the PFCC conference?
I'm kind of curious if others who weren't in attendance, hearing what you have so far today, if you would be interested in attending either another conference or get together in LA County, to learn with one another, learn from others. Just curious if it's something that everybody would be interested in. And you can do a thumbs up or put it in the chat.
I would be.
I know. I know we definitely would, yeah.
Emily says yes.
All right, cool. I
Awesome.
was just curious.
Yeah.
Laura, a quick question. Will any of the resources, I thought I think Ray was doing some recording there. Will any of those resources be available for possibly those members that didn't attend the conference and wanted to maybe view some of those sessions?
Yeah, so the larger sessions, and Lindsay, you might have to help me out a little bit because I was out directly after the conference. So the larger sessions were recorded, and I believe we will kind of be rolling that out along with a few of the other resources throughout the conference.
Yeah, absolutely. I think, yeah, it's hard to share everything that happened in that day, but there will definitely be more to share. There's lots of pictures too, you can see these two on the screen that we can share as well. But as far as content goes, I think it's just gonna take our small but mighty team a while to put that all together and get out, but definitely.
Mm-hmm. And we will make sure to share it with you all.
Awesome, thank you.
Mm-hmm. All right. Well, I will go ahead and pass it over to Lindsay to talk a little bit about PFAC recruitment.
Awesome. Thanks, Laura. So as Mike had shared, first of all, PFACs are patient family advisory councils, as Laura had described in the beginning. And as Mike had shared in the beginning, recruitment for advisory councils is consistent, like happens all the time. But right now there are health centers and hospitals within LA County that are looking for patients, family caregivers, really anyone with a lived healthcare experience who is interested in, partnering with the health center or hospital, sharing their lived experiences within that the health system, all in an effort to help inform improvements for other patients and family caregivers. So on the next slide, I just kind of took the slide that Laura had used early on to describe the Patient Family Partnership Hub. But as she mentioned, there are 11 patient family advisory councils all across DHS. And the health centers and the hospitals, they went through a long process to develop their advisory councils as really a resource to the health center or hospital, that consistent feed of the patient and family caregiver perspective that is embedded in the work that these health centers and hospitals are doing. So, I'm sure each of you have, had your own healthcare experiences, can see from your own perspectives the opportunities that there are to improve processes, the experience of care for other patients and family caregivers that will be going to those hospitals and health centers. On the next slide, I wanted to just kind of level set, because sometimes when you hear patient family advisor or patient family advisory council, it sounds really formal and like a big commitment, which it definitely is a commitment, but it's not a big one. Sometimes people also think that, you need experience or credentials or, to be a staff member, to be a part of these councils, but that's far from the case. All you really need to be a partner in healthcare, a patient family partner is what we use sometimes, but the more common term is patient family advisor. It's really just having a lived experience and a passion to improve healthcare in partnership with healthcare staff. So the nurses and clinicians and administrators that really run the health centers and hospitals, they want to hear from you and from your own lived experiences, because they want to make sure that the care that they are delivering is what is working for all of you as patients and family caregivers. So on the next slide, I've actually listed out who is recruiting. So who's looking for patient family partners or patient family advisors to join them. So these are all advisory councils that are currently doing an even stronger push to recruit and grow their patient family advisory councils. So if you have had experience at any of these hospitals, so all of you UCLA Medical Center or Harbor UCLA Medical Center, we are happy to connect you with the contacts there. And then also if you're a patient at any of these health centers, so Hubert H. Humphrey, the San Fernando Valley Health Center group, which has multiple community health centers and health centers. So CHC, I use these acronyms because it was just taking a lot of space on the slide. So sorry about the acronyms, but CHC is Community Health Center Group and HC is Health Center. So if you're a patient at any of those health centers under San Fernando Valley Health Center Group, Metro Health Center Group, or San Gabriel Valley Health Center Group, these are all advisory councils that are looking to partner with you. So I wanted to share that. And again, if you are interested in, potentially committing a little bit more time to your local health centers, where you and your community are receiving care, you can reach out to us and we would be happy to connect you. I know I mentioned the commitment. Typically, these advisory councils meet, some meet in person, some do online meetings like this, and typically for an hour monthly. Some are every other month. So it just really kind of depends. And I will say, a lot of these advisory councils are just getting started. So it's a good time to get in and start fresh with these teams with other patient family advisors within your community to really help grow, how you as a patient or a family caregiver are engaged at Los Angeles County Department of Health Services. So I'll stop there and see if there's any questions about patient family advisory councils here at DHS, or how to get involved, or what else this might entail. So any questions, or if you're interested, you can let us know here. All right. Well, you know where to find us if you have any questions, and we will also follow up with the contacts at each of these facilities. So the two hospitals and the health center groups. So if you would like to reach out yourself and jump into an advisory council, you can do so as well. But thanks for your time. Really appreciate it.
Thank you, Lindsay. All right. And the last thing we have is an engagement opportunity for you all. So it's an opportunity for you to it's a speaking engagement. So the LA County Health Services Leadership Development Program is having a reunion for their leaders across LA County And these leaders are folks who have gone through the leadership development program. And they're going to be talking about strengthening emotional intelligence to foster a safe team culture. And so they are looking for 1 or 2 patient family partners like you all to share your experience receiving care and partnering within LA County Health Services. So when I say 1 or 2, so you could see that the dates for the event are August 17th and 18th. And each day will be 2 different audiences. So we could have 1 patient family partner do both days, or we can divide it up. If we have 2 folks interested in sharing your experiences, we could do one day and another the other day. So the audience of this event will be, like I said, leaders who have gone through this leadership development program, and they are really committed in the mission of providing extraordinary care, and they want to work together with each other and with you all to create, again, this safe team culture within LA County. So, like I said, they are looking for someone to share their experiences. So this could include sharing your own story of how you came to be involved here with us, or if you are in one of those PFACs like we just talked about, how you came to be involved in that PFAC, and an experience within receiving care within LA County to kind of open up the day. So if you are interested in speaking at these one or both of these events, feel free to contact me. My email is in the chat. It will be very soon. And I don't, let me check on that, Maria.
Yeah, and Mike, do you happen to know the hours of?
My initial response, I think, is probably going to be in the mornings. I think our leadership development program team is aiming to kind of kick off these events with the patient story. So I'd imagine that there'll probably be sometime in the morning.
Thank you, Mike.
Yep. But even then, if you'd like to, I think there's a couple different ways to engage with this, right? Either being there present for those days, or even possibly recording a video is also an option as well. So I think we are willing to work with any one of our patient family advisors that would like to participate. If you're interested, we will work with you to try to, get you to share your story any way you can.
Yes, thank you, Mike. Yeah, we will definitely be prepping with you. We're not just gonna say, okay, speak. We will be prepping with you before the event and helping you throughout the process. That was a great question, Maria. Any other questions about this opportunity?
I know, Ray, you have done something like this before. I'm curious if you have any, insight or advice on speaking engagements like this from what you've done previously.
Yeah, just to share a little bit. I mean, speaking engagement was, it was really nice to be a part of. Just to share my personal experiences and just the connection with people and how we work together, and then how I transition in giving back in that way of being part of the patient advisory council and making a positive impact on patients. And just it feels good to do that, and hopefully that's something they'll take into their careers and and know how to keep an open mind to work with the PSA and know that it's a two-way street. You know, it's good to know we exist and how we kind of bridge the gap between patients, you know, positive things and also things that need to be improved, to reach out to the right departments and things of that sort. So it was good to be a part of that, and I like the casual way of that it went. You know, it wasn't too structured. They gave us enough time to kind of speak on things, and yeah, I had a good experience overall. Thanks for that.
You know, like how you said, it also, you know, raises awareness about, you know, there are patients and families who are willing to partner with the DHS staff as well. I think that's a really good point. Thanks, Ray.
No, thanks again, Ray. You know, I think anytime we could, you know, share our patient story with a group of leaders within our health system, it just sets the tone for the day. You know, I think energy, you know, when Ray shared his story, I think the energy was felt throughout the day. Everybody was super engaged in the work that we had to do and still are, right? In terms of following up on everything we set up upon doing that day. So, you know, this is a great opportunity to share your story with leaders of our health system, again, you know, to help us make change across.
Yes, yes. Thank you again, Ray, for sharing. And yeah, like Mike said, we had some wonderful feedback from when Ray spoke, and they said it was very energizing, re-energizing. I think that was one of their first meetings back in person as well. So yeah, seemed like it was a great experience on all ends. So thank you. So if you are interested, again, my email is there in the chat. Feel free to let me know. We do have time to work on your story. If you need help, we are here to help you, and here to help guide you through the process of the engagement. Yes, Michelle.
Okay. I had emailed, I think it's Laura, a while ago, like 2 months ago. And I'm not sure how my story would relate because I've never been involved in it before. So, but I know it would connect, and I know that for sure because I found you guys.
Yeah.
And I wasn't even looking for you guys directly, but it was connected. So, and if I could just say a couple of words too, so people would know what I'm saying, because I don't even know what I'm saying if I was listening. I was looking how to make a complaint over foster care, how we're being treated, me and my child. Then I found out, oh, DHS is over foster care. I wasn't able to get any help because it's a legal guardianship. So that's enough information for you guys to know what I am still searching for, seeking for. In hindsight, I have high blood pressure, I have all kind of sorts of things going on. And then that's it. But I don't know how to make that story relate to, I don't know if it does in other words, but I would love to participate.
Okay. Yeah, I think we can get in touch and we can work through, we'd be happy to help you. I think we have some tools too to help you kind of put your story together. And actually, I can also send you, and maybe I can send it out to the group too. This last Friday, we had a coffee chat within our network, and it was all about storytelling and how to put your story together. So that might be something good for you all to watch, just in general, for the future or for this event even. And we haven't uploaded it yet because it was Friday, but once we do, I'd be happy to send that out to you all as a resource. But like I said too, we will of course be working with you for this event as well. So thank you, Michelle. We can get in touch after this. All right, I think we just have about a minute left. So any other questions or comments on this event? And we will it will, if we haven't found anybody by our next meeting, we will have this again in the next one. So if you have any questions that come up, feel free to email me. Again, my email's there in the chat, or ask at our next community conversation. All right, everybody. Thank you for joining us so much. Thank you so much for joining us today. Our next community conversation will be June 26th, same time, same registration link. So feel free to join us. My email is there on the screen. If you have any questions about this meeting or anything in general, feel free to email me anytime. And we will see you all in the next meeting. Thank you so much.
Thank you.
Have a good evening.